It's a satisfaction that you've made a change. And that's what the companies have done. This is one I truly believe is going to pave a highway of creating an army at the bedside of better clinicians in terms of wound care. That's what I'm excited about.
And I really like that point. I mean, it's not, I think a lot of people in the healthcare setting are not, they're not driven by the money outcome. Obviously everyone needs to sustain themselves, but I think it's the passion that they bring into it, because they know that there's an outcome. That outcome is helping people get back to their lives, helping people feel better. And actually, it's the outcomes focus that I think makes a big difference. So, and again, this is not everybody that has that mentality. So it always helps to have a clinical background. You've experienced it firsthand. You know exactly what it's like to help these people out. So that's an important factor that not everybody has.
Yeah. Well, thanks for agreeing with me on that matter.
Okay. So I wanted to touch on the topic of wound care itself, because I did a little bit of background research, as I do for all guests, but one of the things that I was very surprised by is just the size, I guess, of this field. I didn't realize it was so big. It encompasses a lot. It's not only big from a market perspective, but it affects a lot of people. So we're talking about a very wide range of clinical, medical, real life applications of this. I wonder if you can speak to that a little bit. What's the scope of the wound care practice?
I sure can. Now, just so we're all clear, I reside in Canada. I reside in a province, and I reside in a small area. And in this small area, just let me illuminate this for you just for a second. We've got hospitals, we've got long-term care, we've got community placement, we've got clinics. So let's have a look at community, right? Bricks and mortars, streets where people live. I know for a fact on a Monday morning, one of the agencies deploys 350 nurses on a Monday morning. And they have to do roughly 10 to 12 visits to, substantiate their payment for that day. So 4,200 people are seen on that Monday morning. 48% are wounds. And you know what? Of those 350 clinicians, there was 4 or 5 of us, wound specialists, that ran out and dealt with that need. It just doesn't cut the mustard. So in my province, it's a $1.5 billion burden on the tax money. In North America, I just don't even go there. I don't think I can come up with a number that big. You talk about wound care, people think, well, how do you make a career in wound care? Like, where are the wounds? You have no idea. You have no idea. It's a massive, massive, multi-billion-dollar market. So we're trying to contain costs. We're trying to get better care at the bedside. And the problem is, and I'm probably jumping into several of your questions in the future, I don't mean to, but every nurse needs to know about blood pressure and INRs and patient drug amount training and all this stuff, but they don't have to know about wound care, because they have somebody in their facilities that's been educated and is the wound clinician. And that's not right. You should not have one person in a silo in a hospital or long-term care that has all the knowledge, or a couple. Everybody that's dealing with your mom's foot should be able to know what they're doing, what they're seeing, what they're applying, what the outcomes are, what the teaching for your mom should be. And that's not the case. Ergo, iWound. That's why we've created that.